A landmark challenge to the Canada Health Act began in BC Supreme Court this week. Dr. Brian Day has taken his 8-year legal battle to court in an effort to provide a framework for private healthcare to operate in BC. Dr. Day, who operates the Cambie Surgery Centre here in Vancouver, had his lawyers argue that the provincial healthcare system tramples on the constitutional rights of British Columbians. Lawyers argued that, quote, there is no universal equality of access nor timely access to needed health services, and, quote, the public system simply cannot meet the healthcare needs of all British Columbians in a timely manner. It is necessary for the health of all British Columbians that private financing and private support in provision of core health services be permitted. Now, this all sounds good to someone like me, but for whatever reason, the term private healthcare has always been heresy for many Canadians. But why is that? For one, our healthcare system is nothing special. Our costs are soaring, and unless you have a serious illness like cancer, the system is very difficult to navigate. And don't even get me started on our ineptitude for mental health conditions. In other countries like Britain and France, they use a public and private system running parallel to each other, and they deliver care at a lower cost to the taxpayer. So I think it has something to do with Canadians' inferiority complex towards our American neighbors. For decades, we snickered and joked about our American friends' private healthcare system, always proclaiming moral superiority with our universal healthcare. Well, in came the disastrous Obamacare, and as expected, their costs are soaring too. And now even Donald Trump is promising to repeal and replace Obamacare completely. I've never understood why Canadians treat universal healthcare with such reverence. Remember back in the 2000 leadership debate, when Canadian Alliance leader Stockwell Day stood on stage and held up that stupid no two-tier healthcare sign? In many ways, that was a chance for the party to break the mold, to have a platform that could have transformed healthcare in Canada for the better. But at the time, the Alliance was trying very hard to break through in Ontario and Quebec, places they take public healthcare seriously, I guess. But little did they know that future Prime Minister Stephen Harper, when he was merely a one-term former Reform Party MP and had recently resigned to work for the National Citizens Coalition, he had this to say back in 1997 about two-tier healthcare system in Canada.
What do you think about a parallel private healthcare system for Canada?
Well, I think it would be a good idea. I think we're headed in that direction anyway. We're alone among OECD countries in deciding that we'll have a two-tier system, but our second tier will be outside of the country where only the very rich and powerful can access it and will be of absolutely no benefit to the Canadian healthcare system. So I think this has been the wrong way to go, and clearly we're moving in another direction now.
But Day and the Alliance killed that idea in 2000 and failed to shift the debate on this issue for 20 years, as all major federal parties, including the Conservative Party of Canada, have supported universal health care ever since. With Dr. Day's court case, many public healthcare advocates and their friends in the media party are already mounting a campaign of fear against changes that would allow private care. Check out this headline from CTV News. BC lawsuit, potentially a disaster for universal health care. Or this one from the Toronto Star. Opponents say any constitutional challenge of Medicare is a profound threat to the health of everyone in Canada. Well, as usual, making an emotional plea is what the left does best. But what about some facts? Those usually aren't the friends of lefties, and this case is no exception. We actually have data from right here in BC. Longwoods.com does public research pertaining to healthcare, and they put out a 2011 study that found that workplace injuries that required surgery were expedited by the Workers' Compensation Board, who paid the hospital and surgeon extra to prioritize a surgery and post-surgery recovery. These patients were operated on 15 days sooner and had a combined wait and recovery time 26 days shorter than those who didn't have WCB bribing the system. So not only do patients get treated sooner, they are back to work sooner. This means that they are back paying into WBC much sooner, and they spent less time collecting WCB. So this is all a big net win for the taxpayer. And this is something the RCMP, Canadian Forces, and fire departments have been doing for years when their employees get hurt. There's also this basic thesis that I have that even those wealthy enough to pay out of pocket and do so will be stepping out of the queue for the one-payer system. And this would relieve the stress on that single-payer system. So you've got new spaces and less demand, and so queues will shorten. But the fact of the matter is, we already have a two-tier system in Canada. Just ask any professional athlete who is injured. They often get surgery, sometimes even the next day. Or what about our politicians? Even Jack Layton famously used a private clinic in the 90s to have surgery on a hernia. Dr. Day's case will be in court until February. I'll keep you updated on this landmark case. And let's hope for the sake of all Canadians that the decision helps improve our access to care. For the Rebel.media, I'm Christopher Wilson.
Thanks for watching. Click here to never miss a Rebel update. Want even more of the Rebel? Well, click here to become a premium member.